Hi, this is E. David Crawford, Editor-in-Chief of Grand Rounds in Urology. Very honored to have Dr. Neal Shore from Atlanta Urology Clinics in Myrtle Beach, South Carolina, join us to talk about a recent article that was published in Reviews in Urology entitled Preserving Independent Urology, LUGPA's First Decade. I've never met anybody with so much energy and leadership as Neal. And Neal, thanks very much for taking time to review this article with us today.
Well, David, thank you so much, and for the very kind words. It's been an incredible honor for me to have been able to participate with so many of my colleagues who back in 2008 we recognized that community independent urology practice was really not being as well represented as it could be. Many of our academic colleagues were focused on other priorities. And so we really started LUGPA. We're in our 11th year now, and we wanted to make sure that patients had as much access to independent and integrated care at their site of choosing. And as most would recognize, the last 10 years we've seen tremendous competing forces in the healthcare landscape. And sometimes there have been some legislative challenges, and that became a big part of the LUGPA mission and vision, which is to advance and preserve the independent practice of urology. And our article does a really good job, I think, of really explaining not only the history of our inception, but some of the many different components as to why LUGPA, Large Urology Group Practice Association, became so important. We started with about 20, 25 groups. The actual groups are the members of the organization. And now in 2019, we have 152 member group practices, which comprise approximately 2,400 to 2,500 urologists within the United States. And that doesn't include all of the various advanced practice providers and all of our team, which allows us to provide community urology care. But health policy and advocacy became a very strong component of our mission. We really have three components, and that's a chief component. And many of the things that we've fought really hard for is to preserve what's known as the IOASE, or the Independent Office Ancillary Service Exemption, which allows community practice physicians to have diagnostic imaging, laboratory services, inclusive of in-house pathology, or radiation services. And one of the things we've also promoted is research and clinical trial advancement, and educational advancement for busy and integrated and evolving community urology practices. Getting back to just some of the health policy and advocacy objectives, I mentioned the IOASE, which is an exception to the Stark Law, and that law currently today is really undergoing tremendous scrutiny and revamping, so that we can all participate in value-based healthcare. LUGPA has championed the importance of value-based healthcare over volume-based healthcare. We also are very emphatic about the importance of obtaining site neutrality, so that the same work being done in a clinic and an outpatient service is not denigrated in terms of the reimbursement that one would get oftentimes of significant multiples in inpatient or hospital-based systems. So we're just trying to level that playing field and make it fair for there to be a fair competition. And so we also weighed in very heavily on the United States Preventative Services Task Force on PSA screening. As you have said, David, and others have demonstrated, judicious and appropriate monitoring and careful and appropriate use of PSA is what's needed, not with a wholesale disregarding of testing. And we've really fought back very hard on that. And we've been able to do it through a tremendous amount of dedication and using a lot of our resources with our consultants and experts on the Hill in Washington, D.C. And so many of our member practices have taken the time to go to the Hill, meet with their elected representatives in Congress, particularly as for health policy issues, and help us get our points across. So again, things such as site-neutral payments, value-based care models, the reform of USPSTF, these are the things that we've focused tremendously on. And then additionally, in our 10 years, and that's why we wanted to write this article, is to say that the way we've also added to the wonderful education that the AUA, SUO perform. We have our own education that is particularly more centric to busy, integrated, expanding community urology practices. So we have regional meetings, we have Prostate Cancer Academy, Bladder Cancer Academy. We have an annual CME program, which we've been honored to have you present there, many times, and you've been exceptional. And I would be disingenuous if I didn't recognize the fact that we still have headwinds, and a big part of the headwinds that we face is the competitive landscape and the competing what I call the competing, frontal lobe space for busy community urologists and even academic urologists as well, whether they're in a for-profit or non-for-profit organization. There are really dramatic sea changes occurring in the employment of physicians, and urologists are no exception. So we have to compete for funding with for-profit organizations, whether they're hospital-based or group purchasing organizations. LUGPA, like AUA, like SUO, is a nonprofit organization dedicated to really advancing the house of urology. All of the aforementioned organizations are clearly well-intended, but they have a different mission and vision. I'm incredibly proud of all of my colleagues. It's been so many great physician and non-physician leaders. At LUGPA, we've really strove to have many of our enormously talented administrative non-physician leaders part of our board and part of our leadership. And I'll just finish by saying we started LUGPA Forward, which is an organization of our members who have finished within 15 years. Essentially, they're younger, but they're also have great skills that some of the older generation don't have. They're more diverse, and it's their leadership that we're really promoting, because if we can do that successfully, then I think everyone benefits in the United States by having many different alternatives to seek their health care, and to also promote the best in healthcare, whether it's optimizing pathways and guidelines, but also in promoting research and being at the forefront of education. So thank you very much for allowing me to talk about the article.
Neal, thank you. It is a great article, and it is in Reviews in Urology, and if people want a copy of it, you can contact Grand Rounds in Urology, and we'll figure out a way to get you a copy of that article. Neal, the LUGPA has made a significant contribution in the last decade to urology, and urology really is a small group, and we all need to work together and make 2 and 2 equal 5. Just a plug, we're having a panel at the International Prostate Cancer Update, the 23rd to the 26th of January in Beaver Creek, on collaboration between LUGPA and academics and other parties that are involved in urology. Do you want to comment on that just a little bit for the last minute of this?
Yeah, well, thank you, David. You're absolutely right. The optimal model the multidisciplinary team. It's all about collaboration and collegiality. And there are different models depending upon, maybe what part of the country you're in, and if you're metropolitan or suburban or rural. But at the end of the day, if we don't all work together well, and we have to avoid internecine warfare, which, this sort of specialty against specialty, or hospital-based against community, or academic versus independent. That to me is just really a ludicrous way to move forward. We have to work better together with transparency and clarity of mission, which is to maintain the best care for the community and the patients we serve, but also to keep urology such a wonderful specialty that it is. And it really is a great blend of surgical skills and medical management and research. And I just think that if we can all work better together, even though that sounds rather possibly prosaic, but we have to avoid turning the arrows in a circular firing squad. And if we can be collaborative, and your conference IPCU with LUGPA is one of those great vehicles for coming up with new ways to better our career and patient management.
Great, Neal. Thanks a lot for your comments, and we look forward to seeing you at that conference. Thanks a lot.
Thank you.